So it's a little bit tricky to palpate. Sometimes we don't have a lot of experience, and then study says that we are not very reliable because we have never done it. So it's normal. Good. So studies are correct. Now, let's say that you find a trigger point in, let's say, in scalenus medius.
미디얼 파트.
Good. And you like to work with it. So you have some options. A very good option is to work in a 2B. Hold the trigger point, and to start moving the head, like with rotation. Yes, you can do a little bit of 2A. Going with the fibers, it's not very easy to go transverse. It's to go with the fibers longitudinally and work the area. It's not very easy to do a technique 3 because you have the brachial plexus, so it's not very easy to say, okay, let's have a technique 3 in this area, and we don't have a technique 4 for this area. Yeah, it's not easy. So this is the trigger point problem. As I told you, sometimes I have this thoracic outlet syndrome, I have this impingement, and I like to really have more length in this muscle. That gives you two positive things. The one that you have better neural mobility of the plexus, so you need to elongate the muscle. And if you are elongating the muscle, you will have more side flexion of the lower thoracic, which is in a lot of people restricted, and these people are starting to compensate with upper cervical, lateral flexion, so they create hypermobility in upper cervical spine because they are hypomobile in lower cervical spine. No? To repeat? Yeah. So the one thing is trigger point. Mainly you do a technique 2A or 2B. Very good. But personally, I use more often techniques to have more length in the scalenes, either to have better neural mobility of the brachial plexus, or to have more range of movement in lower cervical spine lateral flexion. A lot of people have stiff scalenes, so their lower cervical spine cannot side flex because of the stiffness. When they like to have a lateral flexion, they are not moving the middle and the lower cervical spine. They are using, like here, the chin movements, which is lateral flexion for the upper cervical spine. You can see here, the middle and the lower cervical, it's totally still. They are not moving. So if you see in a person that he side flex the neck, but the neck is straight and only the chin is moving, that's upper cervical lateral flexion. Use more vertebra to do this movement, so you must move also the vertebra that are in the middle and the lower cervical spine. If you don't use and you are hypomobile in lower cervical, you are becoming hypermobile in upper cervical. Mm-hmm. But this hypermobility can lead to have headaches, to have problems of the upper cervical spine connected to the upper cervical spine. So in these patients that they have movement, but they have some symptoms, I try to find movement in the lower cervical. The scalenes are the main muscles to make for the difficult side flexion for the lower cervical spine. So I must elongate them. And this will give more space for the brachial plexus as well if you have better mobility on the side of the neck. So it's good for the neck to have more mobility, but it's good for the nerves going to the arm. So how to do that? It's not easy. If you are asking a patient to repeat side flexion, he repeats his pattern, which is upper cervical, so it's difficult to teach. If I try to take the lower cervical and bring it in side flexion, the shoulder is moving together, so he's not giving length to the scalenes, he's just doing side flexion of the trunk. He's compensating by the trunk. Can you see? The trunk is side flexing, it's shortening on this side. So if I keep the shoulder and I bring the neck, then I'm stretching the trapezius, but not the scalenes. So what I should do is to find the first rib, keep the first rib down to stabilize the trunk, but not stretch the trapezius. And the first rib is the origin of the muscle, and try to have side flexion by keeping the first rib down. Yeah, that's the strategy. So you have the muscle fibers of the origin and the insertion to the first rib, and you try to elongate these fibers. I use a higher bed. It's not very easy. You need some time to adapt on this. Can you come out of the bed? And yeah, come.
머리 밖으로 좀 뺐어.
Good. Stay. So I'm asking the person to be out of the bed. And usually I use my belly, and it's nice to have a good belly like me because it's very nice and stabilizing for him. If you have a nice belly like me, it's time to think about creating one.
sometimes crazy 하지만 sometimes 너무 좋은 거예요.
And what do you need? It's not a lot of extension, it's not healthy, not a lot of flexion. You try to find a neutral alignment in axis of flexion extension.
네, 지금 뉴트럴 자세를 잡습니다. 이렇게.
And you must stabilize on your belly to have free hands.
그렇게 되면은 핸드가 프리하게 되겠죠.
The second thing is that you like with your fingertips to have all the cervical vertebra stabilized. So you are not taking the head, because if you go with the head, you are using more the upper cervical flexion, side flexion. You need to take all the vertebra with you. So you must grasp all the vertebra.
그래서 왼손으로 버테브라를 딱 잡아줘야 됩니다. 안 그러면은 또 사이드 밴딩 할 때 어퍼 파트가 많이 움직이니까.
Then we call it this thrusting finger. You slide with the thrusting finger to reach the first rib. It's the first bone. If you go directly to the side of the neck, it's the first bone to find. Yeah? So I'm stabilizing with my good belly. I have the legs spread apart. I have my hand on the vertebra, and I'm sliding, and with my thrusting
이
finger,
손으로 첫
I'm
번째
keeping
립을
the
차다시
first rib
들어갑니다.
down. And then I'm locking my shoulder to my body.
저 몸으로 락킹 딱 시키시고.
And then I'm keeping the right hand stable, and the left hand with my body is moving far from my right hand. My right hand is stable, and I'm moving my body away from my hand.
오른손으로 딱 키핑 하시고 보조하시고 왼손을 가지고 왼손에서 오른손이 멀어진다는 느낌으로 하시는데 몸을 이용해서 하시면
This is a mobilization of the lower cervical spine inside flexion.
몸으로 사이드 플렉션을 만들어 주십니다.
What is wrong? Look, I will do it wrong. It's to move the belly first, so he does side flexion of the upper cervical. You must move the hand, not the belly. For the middle scalene, if you like to have the anterior scalene, you must rotate ipsilaterally the head and then go to side flex. If you like to go for posterior scalene, you must go to contralateral rotation. He's a bit better on posterior. He's stiff on the medius a lot, and he's very stiff on anterior. Good. So it's not very easy to do it. There are problems. So you must really focus so the chin to be in the same line with sternum, to not have a chin out. That's a problem. You must be stabilized to not have a hanging neck or to have a flexed neck. Another problem people have is that they cannot isolate the right arm from the rest of the body. So the moment they go to the left, they bring also to the arm, but then they are not pushing the first rib. So it needs a little bit of synchronization and to need to play a little bit with your legs. Can you come sitting? Let's see the test. Side flexion test on this side.
Comfortable.
Yeah? And you can see now it's more pronounced. I think now it's hitting your eyes. When he goes this direction, he's using a lot the chin, so the upper cervical, and it's very straight, the neck. Go on the other. Here you can see a little bit more neck movement. Can you see the axis of the neck angulates toward the sternum? And of course, he's using a lot of compensation with the upper cervical from the other. But here it's not angulating a lot the lower cervical. It's more the chin strategy. Good.